At nagbabalik mga kasambahay ang Doctors on TV. Ang topic natin this morning, corneal diseases. Ang cornea ay nasa mata. Panoorin muna natin ang video na ito.
Ang vision impairment o pagkabulag ay ang nangungunang sanhi ng disability sa buong mundo. Tinatayang nasa 45 milyon na katao ang bulag o may malalang problema sa mata. Sa Pilipinas, tinatayang nasa humigit kumulang na 500,000 katao ang bulag o 0.70% ng kabuuang populasyon ng bansa. Ilan sa mga sanhi nito ay ang katarata, glaucoma at corneal diseases. Ang corneal diseases ay isa sa mga itinuturing na highly preventable cause of blindness. Tinatayang nasa 4.9 milyon na kaso ng pagkabulag ay dahil sa corneal scarring na resulta ng corneal diseases. Ang cornea ay outermost layer ng mata na nagsisilbing proteksyon ng ating paningin laban sa alikabok, mikrobyo at iba pa. Dahil dito, ang cornea ay prone sa trauma at impeksyon na kung hindi maaagapan ay maaring mauwi sa visual impairment. Kaya ngayong umaga, ating pag-usapan ang mga karaniwang corneal diseases at kung paano ito maiiwasan. Kasama ng mga expert, Doctors on TV.
At yan po mga kasambahay, ang topic natin for this morning, corneal diseases.
At syempre, para mas maipaliwanag sa ating mabuti at maintindihan natin ang ating topic sa umagang ito, we invited a very competent and very kind doctor. Dr. Vicente Santos Jr. He is an ophthalmologist and also the president of Fatima University Medical Center. He is also an educator and board member of Fatima University. Our favorite, Dr. Vicente Santos.
Hey, good morning. Good morning so much. Thank you for having me again. Thank you.
Thank you for joining us.
Thank you.
Yeah. Gusto ko si Sir nag-guest sa atin kasi
Super
pinapakita
favorite
yung
ko
mga
din.
latest technology sa Fatima.
Yes. Tsaka very clear pa nag-explain si Doc. Parang hindi ka talaga matatakot, wala kang katatakutan at mabilis ang procedure.
Thank you. Thank you so much for those kind words.
Okay, Doc, tinawin natin ang topic natin this morning, corneal diseases. Saan ba yung cornea natin at ano bang ginagawa ng cornea?
Well, ang cornea, yun po ang pinakaharap ng eyeball. No? Para siyang, transparency niya parang glass. It's supposed to be very clear. Okay. So it's a light transmitting structure. And aside from that, it also bends light. So, fino-focus niya yun sa retina. Kaya klaro ang image natin dahil sa cornea.
Iba pa yan sa lens, no?
The lens is a second refractive unit inside the eyeball structure. So, refract from the cornea and then secondary na yung lens.
Oh, ito yung
They have to work together.
Ito yung pinapatungan ng contact lens pag nilalagyan ng
Yung
contact
cornea
lens.
ang pinapatungan ng contact lens.
Okay.
Ayan, oo.
Ano ba yung mga sakit ng mga cornea na common sa atin?
Oh, well, we will be having a guest here. Kayo lang mag-introduce sa kanya.
Okay.
Pero actually, ang mga sakit sa cornea, yung mga scarring, yung mga keratitis na tinatawag, sometimes you get ulcers from trauma or from rubbing, from infection. Iba-ibang klase po yan.
Oo. Anong pinaka-common, Doc? Kasi lagi nating naririnig na corneal diseases. Ano yung pinaka-common sa Philippines? Meron bang consideration dyan yung mainit na panahon?
I think most of them will be some form of keratitis, no?
Keratitis.
Inflammation or ulceration. But as I've said, we will be having a guest here who will speak much better. It's more competent
Excited
than
si
I.
Doc. Kanina pa yan eh. Excited siya sa guest. Siguro magandang yung guest natin.
Oo, maganda po siya.
At maganda yung mata.
More competent than me.
Kaya yata ang expert, Doc, dyan sa
Oo,
corneal
nga.
diseases, di ba?
Well, ophthalmology has different specializations. It
Okay.
turns out I'm a retina and refractive surgeon.
Yung guest kasi natin, Doc JM, siya yung nag-opera sa ating 6-year-old
Yes, that's right.
na baby na may problema sa cornea.
Yeah.
Ipapakita mamaya sa ating doctors in action. Ayan, excited na tayo.
Yeah.
But the cornea is it's a avascular structure. Wala siyang blood vessels, no?
Normally, wala siyang blood vessels. If it's, in certain conditions, nagkakaroon ng vascularization, nagsisimula sa gilid, sometimes it goes all the way to the center. At yun rin ang reasons why sometimes nagkakaroon ng reaction sa contact lens. No?
Okay.
Yung part ng cornea that's supposed to be avascular becomes vascularized.
Okay.
So, kapag ganyan po, Doc, madali po bang gumaling yan kapag nagkasakit o medyo mahirap, matagal?
As long as it doesn't scar, most of them can be treated medically.
So, nahihil pala yung cornea?
Yes, nag-heal siya.
Pareho pa rin po ba yung vision nila?
Oh, most of the time,
Most
if
of
it
the
heals,
time,
it comes
okay.
back to its normal.
Fully healing naman.
Yeah.
You get trauma ba from rubbing your eyes?
Yes, you can get trauma from rubbing your eyes.
Sa puwing, Doc.
Yeah, that's the
Lalo
same
na,
one.
oo.
Pag napuwing, makate, mahapde, then you rub it some more, and then you get abrasions and ulcers. You can get that.
Doc, ano yung point of no return ng cornea natin? Paano siya masasabi na hindi na talaga siya gumagaling at kailangan na talaga ng mga transplant?
I think if the scar reaches the full thickness of the cornea, then it becomes scarred. So, puti na siya. Tumatalbog na po yung ilaw at di na hulumusot.
Oh.
Oh.
So, makikita to, Doc, no? Pag, is it visible to the naked eye?
Yes, the corneal pathologies are visible to the naked eye. Kung nag-scar siya.
Ayun.
Pati ba congenital? May mga congenital corneal injuries ba?
Yes, I mean, when they, yeah.
Mga baby pa lang, pagkalabas
Yeah.
may...
Ito ba yung sinasabi natin na kapag mataas masyado yung lagnat ng nanay kapag nagbubuntis, posible bang nakaka-damage ito ng cornea?
Sometimes nakakaroon ng congenital, along with other eye problems. And then, yeah. Nangyayari po yun.
Okay, ayan.
And then pati contact lens nakaka-injure ng cornea.
Yes, because there could be a reaction or allergic reaction. There is also diminished oxygen supply. There's also trauma and dryness. So all of that combined to...
So, ayaw nyo, Doc, ayaw nyo ng contact lenses?
Well, it's being used worldwide. I don't think mauubos ang pag-utilize niya, no?
Lalo ngayon, maraming design, Doc, no?
Yeah, but the point is it's very, very safe actually. You just have to remove it, take proper care of it,
And moisturize your
and
eyes.
moisturize your eyes.
How long ba po dapat tanggalin yung contact lens? How long? Pwede ba sinuot ko ngayon? Bukas ko na tanggalin? How long?
Itutulog mo, no?
There are
yung
some-
iba nakakatulog
There are
kasi.
some extended wear contact lenses, but I think as a rule, it's nice to have it just for a day or two. The mga extended wear. But there are some designs that are for longer.
Uso ngayon kasi, para mas
Yes.
lalong gumanda, yung mga babae especially.
Kasi may mga kulay-kulay na
Oo.
Yeah.
Meron
Cosmetic
kayong
na.
manggi, blue yung mata, ha? Saan ka naman nakakakita, no? Di ba
yung
ang
mga
ganda?
walang visual impairment pero naka-contacts.
Meron,
Yes.
may contacts.
Purely cosmetic ang
Cosmetic
contacts.
reasons.
Yeah.
Oo.
Well, sometimes the cosmetic reason has a medical background also. No? Kasi may mga tao na congenitally walang iris. It's the brown part of the eye. And sometimes, yun, nalalagyan ng para hindi masyadong pumasok yung ilaw at masilaw sila. There are contact lenses like that.
Now, when you look in the mirror, ano bang titingnan mo sa cornea mo para malaman mo kung
Well,
may...
it's very hard when you look in the mirror because what you will see is the iris, the brown part of the eye. So,
Okay.
ophthalmologists have this special instrument which actually has an oblique illumination.
Okay.
Mas nakikita yung mismong curvature at structures within the corneal structure.
Unless malaki na, may ulcer na.
Yes,
Na obvious
yes.
na obvious.
Yeah.
Minsan naman may pterygium, yung parang, ano ba yung pterygium, no?
Pugi.
Parang may...
Sinasabi
Pterygium
nila.
Pterygium is an elastotic degeneration of the conjunctiva.
Okay.
Nagre-react yung conjunctiva, yung parang laman sa labas ng itim, no? Yung parang puti. Meron tayong laman ho dyan. Pag natutuyo at na-expose sa ultraviolet, prolonged exposure, dun po siya, tumatawid po siya.
From sunlight.
Yes.
Pwedeng-
So it's
kasi
very common
ibang
among-
patients, kitang-kita na may
Kitang-kita,
parang may
oo.
flesh
It's very
material.
common among fishermen, farmers, people in the field.
Ano to, Doc?
Okay.
Dahil sa init? Sobrang init.
Well, inert, dryness, and ultraviolet exposure.
Kasi
Sunlight
sinasabi nila
talaga.
yung mga mekaniko na nagano doon, welders.
Welding. Yes,
Yeah.
welding.
Yung mga welders, very
Yeah.
common.
Yeah,
Doc,
it's
yan
very-
nagagawa ng paraan yon. Nasa scrape off ba yung pterygium?
Yes, we excise it. And then we
Excise.
put a graft on top of it.
Okay. Ngayon, babalikan natin ng mamaya ang ating magandang usapan. No? But before that, alamin natin ang mga tips para sa ating mga babae. No? At tingnan natin ito, ang tip ni Doktora for Women's Health.